Blackheads. Blackheads are those pesky little open bumps on your skin that seem like dirt has set up camp. But here's the twist. The dark color isn't dirt at all. It's actually an irregular reflection of light off clogged follicles filled with oil and dead skin. Most commonly, they appear during adolescence, but surprise, adults aren't safe either. About 10% to 20% of adults deal with them. Think of your pores like tiny pipes. When oil and dead skin accumulate, the pipe gets clogged. The top remains open, letting oxygen in, which darkens the material inside. Voila, a blackhead appears. Sometimes the follicle gets inflamed, causing redness or slight swelling, making your skin feel like it's plotting against you. Physically, blackheads are harmless, but psychologically, that's another story. They can affect self-esteem, mood, and social confidence. Some people experience anxiety, depression, or even feelings of isolation because of persistent blemishes. Treatment is simple. Cleanse gently, exfoliate, and manage oil. And remember, blackheads are common, not a personal failure. Whiteheads. Whiteheads are like tiny secret bunkers on your skin. Unlike blackheads that peek out, whiteheads are closed, comedones, little bumps where oil and dead skin block a hair follicle or sebaceous gland. They stick up on your skin, usually white or yellowish, quietly plotting their presence. About 10% to 20% of adults deal with them, so you're far from alone. Your face is the usual hotspot, especially the nose, chin, and forehead, but sometimes cheeks or around the mouth join the party. Neck, back, chest, and upper arms can also get in on the action. Think of these areas as prime real estate for oil and dead skin. Why do these little closed bumps form? It's a mix of things. Sebum, skin oil. Production goes up. Keratin, the protein that builds your skin, hair, and nails, forms abnormally, and acne-causing bacteria take advantage of the clogged environment. And of course, androgen hormones ramp up during puberty, which explains why teens often have the most dramatic outbreaks. Whiteheads are usually harmless physically, but they can mess with your confidence. The good news, gentle cleansing, exfoliation, and proper skincare can keep your pores from becoming secret bunkers. It just needs a little guidance. Nodules. Nodules are the heavyweight champions of acne. Unlike the small bumps you might casually squeeze, nodules are firm, painful lumps forming deep under your skin, often with angry red bumps showing on the surface. About 20% of people with acne have them, and trust me, they're memorable. Here's what's happening. Your skin's pores get blocked, trapping dead skin cells, hair, and sebum, the oil your body makes to keep your skin moist. Then C. acnes bacteria moves in, inflammation sets off, and suddenly you've got a nodule. Excessive sweating, stress, or hormone surges are like fuel on the fire, making these bumps even more stubborn. You might see one lone nodule acting like a rogue agent, or several popping up together, sometimes called blind pimples because they're hidden under the skin and refuse to give themselves away. Unlike smaller acne, nodules are painful to the touch and can take weeks to heal. Treatment isn't casual. Topical creams usually won't cut it. Doctors might prescribe isotretinoin or, for hormonal contributors, birth control pills. Nodules are serious, but with patience and proper care, they heal. Papules. Papules are like your skin's polite warning signs. They're small, firm, red bumps that show up when a pore gets irritated near the surface. Unlike nodules, they don't burrow deep under the skin or pack a punch of pain. Instead, they sit just under the skin, saying, "Hey, something's off here." About 30 to 40% of people with acne will notice these bumps at some point, often clustered across the forehead, cheeks, or back. It's inflamed, firm, and tender, but it usually doesn't fill with pus like a pustule or become a deep, painful nodule. Bacteria combine with excess oil in the skin, and a papule is the result. The breakouts are triggered by sweating and heat, which also produces more oil, and combine that with teenage hormones, and you have got yourself a bad skin week. But they rarely leave permanent scars if treated early. Papules are easier to calm with topical treatments, gentle cleansing, and patience. Treat papules right, and you can keep your acne from graduating to the heavy hitters. Pustules. Pustules are the drama queens of acne. These are solid, inflamed bumps on your skin, usually cone-shaped, with a white or yellow pus-filled tip. They're typically small, less than a centimeter, but don't let their size fool you. They can be red, brown, purple, or even the same color as your skin, and yes, they're painful, tender, and irritating. Pretty much everyone gets to experience them at some point, so consider it a rite of passage. Here's the deal. Your pores get clogged, inflammation kicks in, and suddenly your skin is staging a full-on protest. The pressure under the skin is intense, making you want to squeeze that bump like it owes you money. Don't. Seriously, don't. Squeezing pustules spreads bacteria, inflames the area more, and can leave scars, basically turning a small rebellion into a full-blown civil war. Treatment ranges from gentle cleansing and topical creams to prescription medication, depending on severity. Think of pustules like your skin sending a SOS message. They're annoying, sometimes painful, but with patience and proper care, your skin eventually regains control, and peace is restored. Fungal acne. Fungal acne isn't your everyday breakout. It's an infection in the hair follicles caused by yeast. And yes, it's often confused with regular acne. Imagine your pores as tiny apartments. Normally, things live quietly, but sometimes yeast moves in and throws a raucous party, and suddenly your skin is hosting a cluster of small, itchy red bumps. These bumps can stay small or grow larger, sometimes turning into whiteheads or pustules, little pockets of white or yellow pus that look eerily like normal acne. The tricky part? The yeast loves hot, damp, or sweaty skin, which is why young adult males with oily skin often get hit hardest. One day your face or back looks fine, and the next you have a sudden, rash-like breakout. Bumps appearing in neat clusters, all looking suspiciously similar. Each bump may have a red border or ring, and they can be painful, itchy, or burning. Fungal acne doesn't respond well to standard acne treatments because it's yeast, not bacteria. Antifungal creams, shampoos, and keeping skin dry and cool are your best defense. Think of it as evicting unwanted tenants from your pores before they multiply. With the right care, the clusters shrink, the itching stops, and your skin slowly regains peace. Cystic acne. Cystic acne isn't just a pimple popping up before a big date. It's the heavyweight champion of acne, the kind that really makes you want to hide under a hoodie. These are pus-filled cysts that form deep under your skin, often painfully. These cysts aren't shy either. They can be large, red, and tender, resembling small boils, and sometimes a single breakout will cover a wide area of skin, especially on the face where oil glands are busiest. They're persistent, hard to treat, and emotionally exhausting because, unlike regular pimples, they don't just appear and disappear, they linger. And yes, they can leave scars. Cystic acne can strike anyone, but it's most common in teens and young adults due to hormonal surges, stress, or excessive oil production. Treating it often requires patience and medical guidance, from topical creams to prescription medications, sometimes even isotretinoin. With proper treatment, these rebellious cysts gradually shrink, inflammation subsides, and your skin slowly regains peace and order. Acne scars. Acne scars aren't just reminders of teenage breakouts. They're like your skin's stubborn memory of past battles. About 1 out of 5 people with acne will develop scars, but don't panic. Just because you have acne doesn't mean scars are inevitable. Here's what happens. When a blemish forms, the acne pore swells, inflammation ramps up, and sometimes the wall of the pore breaks down. Small blemishes usually heal quickly, leaving barely a mark. But occasionally, the contents of a pimple spill into surrounding tissue, and your skin goes into full-on repair mode. It produces collagen fibers to patch things up, but sometimes it's too much, or not enough. That's when scars form. Scars can take different shapes. Atrophic scars, also called depressed scars, leave pits or indentations, like tiny craters on your skin. On the other hand, some scars are raised, forming bumps that sit above the surface. Ironically, both are signs your skin is doing its job, just a bit too enthusiastically. The good news? Not all acne scars are permanent. With the right treatments, like dermal fillers, laser therapy, microneedling, or chemical peels, your skin can smooth out over time. Even everyday care, like avoiding picking at pimples and using sunscreen, helps prevent scars from worsening.